Our next topic is urinary incontinence. What is urinary incontinence? Urinary incontinence means involuntary leakage of the urine. The first type of urinary incontinence is stress incontinence. What is stress incontinence? Stress incontinence, as its name indicates, incontinence during stress. Such as leakage of urine during activities which increase the stress or the pressure in the abdomen. For example, sneezing, coughing, or laughing. Sneezing, coughing, and laughing, all of them increases the intra-abdominal pressure. And when there's a leakage of urine during these activities, it will known as stress incontinence. The cause of stress incontinence is basically incompetent sphincter or weak pelvic floor muscles. What can cause weak pelvic floor muscles? Stress incontinence is common in females due to multiple vaginal deliveries. The pelvic floor become weak and the person may develop stress incontinence, that is leakage of the urine during activities such as sneezing, coughing, or laughing. Because stress incontinence is caused due to weak pelvic floor muscles. So the first line treatment for stress incontinence is pelvic floor exercises. And if the patient does not get better with the pelvic floor exercises, then surgery can be done to perform surgery can be done to control the symptoms of the patient, and the surgery is open colpo suspension. Open colpo suspension is a procedure in which a free tension vaginal tape is used to suspend the urethra uh, behind the pubic bone. So the initial treatment of choice for stress incontinence is pelvic floor exercises. At least 8 pelvic contractions 3 times a day for at least 3 months. So if with 3 months of pelvic floor exercises the patient symptoms does not improve, then we will go for surgery and surgical retropubic mid-urethral tape, also known as free tension vaginal tape, that is done to control the symptoms. And if the surgery is not possible, pelvic floor exercises failed, surgery is not possible, then the treatment option that we have is duloxetine. Duloxetine will cause a reuptake inhibition of the neurotransmitters, and it will increase the activity of the nerves that are controlling the urethral sphincter. So the power in the urethral sphincter muscle will improve with the use of duloxetine. So a short summary. Treatment of stress incontinence initial is pelvic floor exercise for 3 months. Second line is surgery. And if surgery is not possible, then duloxetine. And the second type of incontinence is urge incontinence. What is urge incontinence? As its name indicates, urge incontinence, incontinence or leakage of urine when the person or the patient feel to urge to urinate. So whenever there is an urge to urinate, there will be leakage of urine. This is known as urge incontinence. Urge incontinence is due to detrusor muscle overactivity. Detrusor is a muscle that is present in the bladder, and due to detrusor muscle contraction, we usually urinate. So due to detrusor overactivity, what happens? The person may develop urgent incontinence. That is difficulty in leakage of the urine whenever a person feels an urge to urinate. In the Plab 1 exam, this type of incontinence will be described as wetting before making it to the bathroom. Because urgent incontinence is due to detrusor overactivity or bladder muscle overactivity. So the first line treatment for urgent incontinence is bladder training, that is gradually increasing the period between voiding. Gradually increasing the period between voiding is the first line treatment for urgent incontinence. And the second line treatment is that if we give some type of medication that decreases the activity of the detrusor muscles. So anticholinergic drugs such as oxybutynin is used as a second line drug. Normally, a parasympathetic system increases the activity of bladder muscles such as detrusor. That's why anticholinergic drugs such as oxybutynin can be used as a second line drug for the management of urgent incontinence. So urgent incontinence is leakage of urine. When there's an urge to urinate, the person usually wet before making it to the bathroom. The treatment, first line treatment is bladder training, that is gradually increasing the time between voiding. And the second line treatment is anticholinergic drugs, that is oxybutynin. Oxybutynin basically decreases the activity of detrusor muscles and relaxes the muscles of bladder, so it can help in controlling the symptoms of urgent incontinence. Third and the last type is overflow incontinence. Overflow incontinence is incontinence when the bladder is filled up to its maximum capacity and then overflow occurs or overflow incontinence occur. What are the conditions that can lead to incomplete emptying of the bladder and collection of the urine in the bladder? These conditions include BPH and prostate cancer. BPH and prostate cancer can lead to incomplete emptying of the bladder and the patient can develop overflow incontinence. Similarly, other condition that causes bladder atony, such as any neurological condition which can lead to the damage to the nerves that supplies the bladder muscles, such as occur in the autonomic neuropathy uh, due to diabetes or atonic bladder in the multiple sclerosis. So two things can cause overflow incontinence. One is any obstruction to the urine, such as BPH and prostate cancer, or any damage to or any paralysis or atony of the bladder muscles, such as in autonomic neuropathy and multiple sclerosis. Remember these four causes that can lead to overflow incontinence. What happens in the overflow incontinence? When the patient bladder is always full, so it will frequently leaks the urine. Weak bladder muscle result in incomplete emptying of the bladder. the person bladder will become overly filled, and even though the person does not feel any urge to urinate, urine will automatically leak due to overfilling of the bladder. Overfilling of the bladder can occur either due to obstruction, for example, in BPH and prostate cancer, or it can also occur due to damage to the nerves that supplies the bladder muscles, such as in autonomic neuropathy or multiple sclerosis. So if the cause of overflow incontinence is obstruction, that is BPH or prostate cancer, then the treatment will be intermittent catheterization. And if the cause is damage to the nerves, then the treatment will be methanicol. Methanicol is basically a muscarinic receptor agonist or cholinomimetic drug. So for urge, urge incontinence, we used anticholinergic, and for overflow incontinence, we are using cholinomimetic drugs. Remember this difference, because urge incontinence is due to detrusor overactivity. So we used a drug that decreases the activity of the detrusor muscles, such as anticholinergic drug oxybutynin, while overflow incontinence is due to